So for now, let's begin our discussion panel. I'm delighted to welcome back Dr. Taiwo and Malaika, who you have already met through their case study videos. And I would also like to introduce two new guests to join them, both of whom have been involved with the Core Nigeria design clinics that we mentioned earlier. So firstly, Dr. Hauwa Kolo, Director of Community Healthcare Services, Niger State Primary Healthcare Development Agency, a medical doctor and public health specialist with over 22 years experience in managing maternal, neonatal child healthcare, reproductive health, environmental health at various levels. Dr. Kolo is an ardent advocate for learning new skills and employing innovative techniques for strengthening health systems in improving maternal and newborn health indices in Niger and Nigeria, which has been demonstrated by her role in various aspects of clinical research, audits, mentoring, and supportive supervision in Niger State. We also are joined by Dr. Olubunmi Akinlade, who is a public health physician with over 12 years of experience working in the public health sector and primarily with Lagos State government. She is an alumnus of the Lagos State University College of Medicine and the University of Liverpool. She currently works as the Immunisation Programme Coordinator at the Lagos State Primary Healthcare Board and facilitates immunisation service delivery. Dr. Akinlade and her team work tirelessly to ensure Lagos State maintains its high immunisation coverage status consistently recorded, for which the state has received recognition awards from the federal government. So please welcome them all. I hope that we have everybody here now and that they're able to unmute. And we will begin some of the questions that have already been posted, and please continue to post those questions as we go through the session as well. Dr. Kolo, do we have you here?
Yes, we do. Good morning.
Wonderful. Thank you. Good morning. I wonder if we could start with a topic that's very much in your area. Could you tell us about your experience using human-centered design to improve MNCH uptake in the COVID-19 context? What have you learned that was new, and what is similar to things you have done in the past?
Okay, thank you very much for that, Ruth. So good morning all. My name is Dr. Hauwa Kolo, as said earlier. I work with the United States Primary Healthcare Development Agency. And in my experience with the human-centered design, we had not had much of the human-centered design experience until March, February last year, where we were approached by the scope team and the CHI team about the study that would be done in the state. And we brought up the topic about maternal, neonatal, and then the child health services, family planning, and also immunization. And we collaborate. It was an opportunity to collaborate and also to learn on this new experience. And then we went into work, and then we were able to innovate and then maintain some of the services in the primary healthcare system, especially in the context of the COVID. And it was also an opportunity for us to find new strategies for service delivery and also for demand creation to go on amidst the COVID situation. So we were able to bring up strategies because we found out that at the beginning of the pandemic, there was fear, and then people were not accessing our healthcare facility, especially to access the maternal, neonatal, and child healthcare, family planning, and also immunization. So we found that even though that the situation was on, our healthcare workers were resilient. They were able to go on with the work, and we were able to. They were able to cause demand creation, and so people, the children under 5, their caregivers, women, pregnant women, and also women of childbearing age were able to access the healthcare facilities. And then we were able to bring up themes out of the work we did also to further help us in the work that we were doing, and also to engage with community leaders, traditional leaders, CSOs, and other individuals in our communities.
That's wonderful. Thank you so much. And Dr. Akinlade, do we have you here as well?
Yes, I am.
Oh, wonderful. Good morning, and thank you for joining us. I know that there have been some network difficulties with various people joining here, so we're always willing to step in if there are any problems. I was wondering if you might want to give some thoughts around the work that you've been doing with immunization and looking at how human-centered design could be used there. What kind of problems might you consider using human-centered design to tackle in the future?
So good morning again, everyone. In Lagos State, fortunately, we've had a relatively good immunization coverage, but because of the COVID-19 pandemic, we had quite a dip in our immunization coverage in the early parts of 2020. So with the immune-centered design, we were able to communicate with both the health workers and community members to find out why people were not accessing services, even though the health facilities were open. So we found out through the HCD that many of them thought facilities were not open because we're not sure, based on the COVID-19 lockdowns and regulations imposed by the Lagos state government, and also because they were just wary of catching the infections when it came to the facility. So with the HCD, we're able to communicate and have like a dialogue between the community members. We had dialogues with the health workers, and we're trying to find a balance to know what we can do better. Because in the past, we've had community dialogues, but we never really involved the health workers, and we never really took in their own perspective. But now we have the perspective of both players, and we are trying to come up with a new design that can help us move forward and make sure that our immunization coverage continues to remain high.
Wonderful. Thank you very much. We've been getting a lot of questions coming through the chat for our case study presenters, which is wonderful. I do have a question here for Dr. Taiwo. Dr. Taiwo, do we have you up and operational?
Yeah, good morning, everyone. I am here.
Good morning, yes, and still your wonderful tropical background.
Thank you.
So we are getting a number of questions about your case study and a lot of compliments. People have really enjoyed hearing about it. I have one question here that's specifically about the funding for the project, because you had to make a pivot, you mentioned in the case study, partway through as a result of the findings you had from this research. How did that affect the funding of the project, and how did you manage that?
Good morning, everyone. Once again, and it's nice being here. Thank you, everyone, for being part of this event. Well, so for funding, we were fortunate to have a very flexible donor who was ready to support us all through the process. Of course, when you get funded and you already had set your timelines, donor would expect that you roll out your activities as quickly as you can, because they also have their priorities and responsibility for accountability, from the sources of the fund. However, because we were able to persuade and to provide enough justification for us to go through this process, so there was a lot of understanding and flexibility for us to utilize portion of the fund to conduct the human-centered research to be able to get, a better approaches and a better ways of doing things, and of course, resulted in a better result.
Please continue.
Yes, so I think that's actually the key part of it. We had a flexible donor who was prepared to understand with us and agree, and so the outcome at the end of the day justified the means, justified the fact that it was a good decision to be flexible around funding. Yeah.
Wonderful, thank you. I have another question here as well from Neka Onwasu. Was there any pushback from the religious leaders in the community when you kind of decided that there was this power maybe lay more with the grandmothers and the mother-in-laws? Did you find that the religious leaders were still on board with you at that point, or what did you have to do around that?
Yes, I saw the comment and I just smiled to myself. That was one big hurdle we had to cross. Yes, there were a couple of pushback from religious leaders, particularly in one of the states. That was really very typical. But the good thing was the fact that our advocacy work was very strong. We had the government officials on our side. We had a few traditional, very highly placed traditional leaders on our side. So a case in point was a particular situation we had in one of the states. In fact, it was even an evening, all through the night, I was following up with calls and making sure that things went well. So before it became a big issue for us. So because we had an emir, a very strong emir, who had bought into the approach. So that's when that incident happened in that community. We got in touch with the emir, who sent an emissary to arrest the situation and to speak, in some of the worship places to the people. Beyond that, we actually engaged frontline religious leaders in those states. We had a lot of engagement with them. At some point, we brought all of them together across the 30 states and we trained them in gender equality approaches. We also got them to look into the worship books and see how they could address gender issues within the worship books. Many of them, so we also got the agency that is responsible for religious relations and religious affairs in the 3 states together. And they worked with the representatives of the religious leaders, their leaders, and they were also able to bring them into several sessions, different consultations and engagements. And so we were able to come up with like a preaching note that has been gender mainstreamed. So that also helped us to get across to the religious leaders. And in no time, after they believed and they agreed with us, and they saw the implications of not allowing us to promote gender equality and all. Then, of course, because of the participatory community engagement that we also had, they were taking responsibility for promoting gender equality information and access of adolescent to reproductive health services in their community. So I think what helped us a lot was the government buy-in that we had in the 30 states, the buy-in of the high-profile traditional leaders, and also engaging the religious leaders at the top level was very useful. We never, after that first incident, we never had any other one.
Wonderful, thank you. And we've actually had a couple of people have asked particularly about adolescent-friendly centres. Is that something that you also established, or would you like to comment on those questions?
So we used an integrated approach where we integrated the adolescent-friendly services into the existing PHU services, primary healthcare service delivery. So for instance, we would select health workers within the health facility and train them, across, the curriculum that we had mainstreamed with gender and of course, adolescent-friendly approaches. And we ensure that, so they gave us a space within the health facility that we equipped with some light equipment just to ensure that they provide that confidence, confidential space. They provide that, attractive space that an adolescent would like to come into. So it was an integrated approach we used because we wouldn't have the human resources to manage a separate center from, the head facility.
Great, thank you. And just finally on that case study, what measures have you been taking to sustain the good results that you had initially with this project?
So that's a very interesting one. And I know everybody wants to talk about sustainability. I really hope that sustainability is actually a result that we all can achieve. And for how long can sustainability be sustained? If that's a way to say. Now, we have involved the communities in so much that I believe that for a very long time, the gains will still remain in the community. We have also integrated the health workers within the health facility. So I want to believe that all the support that we have given, both in terms of capacity and equipment, would remain, and they would continue to provide the services. And we also have engaged the adolescents in a way that they understand their rights, and they all know that they have rights to access to family planning services. And so I am hoping that they would continue to exercise this right. And most importantly, the communities, the religious leaders and the community leaders who have also been engaged through various means. We had this video documentary that we show regularly. We had a promises approach that community leaders would gather and have a conversation around the issues and discuss their role and make a promise of what they would do at their individual level, at the community level, and at where they have influence to ensure that adolescents in their communities thrive. So with all of this, I am hoping that the gains of this intervention will be sustained. We produce quite a lot of documents, the curriculum, the manual, and toolkits that we have given to key stakeholders in the community. I'm hoping that they will be able to make reference to those materials and refer to them when they need to do another activity. We also work with community-based organizations, 2 in each of the states. We are also hoping that whatever they have gained from this project will spur them, maybe they are applying for other programs or other projects or other funding, they will be able to integrate components of this project into subsequent projects or intervention they have, and by that can continue to sustain.
Wonderful, thank you very much. Malaika, I can see that you're here with us. I think, again, we're getting really positive comments about your case study into public spaces. I think it's quite inspiring sometimes to look outside of the field in which we're already working and to see how some of these techniques that you've been using could also apply within public health. So thank you for including that. A couple of questions here. I have one here from Gombe Ibrahim. What role did the community leaders and or LGA policymakers play in that project? And I guess generally, who were the kind of stakeholders that you might be engaging in that sort of work?
Okay, thank you for that question. Before I answer, I just want to sort of give you a really brief idea of the sort of idiosyncrasy of the project. As you can imagine, we had a curiosity and we went out to look for money to sort of respond to that curiosity. So that kind of influenced the nature of the project. So it was a short project. We had 3 days to observe what the community would do. So a lot of the things we did were based on sort of like those parameters within which the project was put together. Now, in response to the question around community leaders, it's interesting because the first thing we knew we needed to do was buy-in. And so we got what we call community fixers. These were people in the community that had the ears of community leaders, they just knew the community. They were like people, when they walk around, you see everybody was just hailing them. So we got someone like that who would then take us into these different spaces and have conversations with different people. So some of the people we spoke to were the earologers, for example. Sorry, earologers. Sorry, I apologize if I butchered that. We did speak to the local government office. Although we didn't get a lot in terms of like feedback, but they were aware of what was going on. But we were more interested in the everyday people in the community because we imagined the park would be something that they would engage with. And because the question for us was utilization, how can the park be utilized? So our focus wasn't necessarily on the community leaders, but more on the people who would be going to use the park. That being said, interestingly, when the project was put together, we had a lot of the sort of like lead community leaders, the balance, the local government chairman, all of them came through the space. We did do some recording of them talking about the space. Interestingly, there was a lot of nostalgia from them, talking about the fact that parks used to be a core part of Lagos back in the days before, urbanization took over. And so from there, the buy-in was fantastic. We learned so much about the community that I don't have the time to talk about, that someone asked me about it here, because I can talk about this project for days. But yeah, they came in, they came through. Unfortunately, the scope of the project was kind of nuanced. Placemaking was even something that they didn't really understand. So trying to, we didn't go there to educate. We went there to extract information. And so a lot of our work was about observing, keeping quiet, and validating the results that we were getting, as opposed to actually saying, oh, can you participate in this? Can you support us in this? And ideally, we wanted to create some kind of traveling installation where we'll take it to different communities and the idiosyncrasies of the community will change. Whereas this was quite a busy community and we're right at the center of it. It was interesting to see, I just going to throw in this event. In Nigerian context, when you have an event, particularly because we invited people were expecting food and drink. But we knew that the nature of the park was to not have food and drink. So we intentionally did not make food or drinks available. And what we found out was the first day that we got there, people came to us, mothers in particular, and say, you won't even give the children water. And we were like, no, they can go. The park is here just for people to come and go. We don't expect them to stay here and sit down. Okay. And the parents complained and complained. What found out was the next day, the same set of children and the same set of parents came back, but didn't ask us for food. And these were some of the kinds of observations that we were trying to make. For example, to say, do you need a park? Sorry, do you need food and drinks in your park for children and families or community members to use it? So yeah, I'm sorry, I said wait, because there's so much to be learned. But yeah, the main thing is that they did come. At the start, they didn't really understand it. And because we went there to fact check and just figure things out, it was difficult for us to be specific with them as to how they could be involved. It was more around just saying, this is what we're trying to do. But interestingly, when the project was in full swing, for the 3 days, we would have different members of the leaders trickle into the space and engage with us and talk to us and want to be heard and use our platform for a sort of like publicity or sort of like agenda. So that was interesting.
Wonderful, thank you. There's also a question here from Dr. Musa in Kano State around security challenges. Did your product explore any of the security challenges that act as a barrier to utilization of public spaces in Lagos?
Yeah, security was a very interesting conversation because security, when we were thinking about security, we knew that we didn't want any sort of formal or police uniformed people because we didn't want to create that barrier for the community to not want to go in. We also knew that in the space that we're trying to do things, there were a couple of questionable characters around that there. But because we had a fixed staff, we had a lot of conversations about what kind of security we can provide for the 3 days there. In itself, the fact that we had family members coming into the space and children, we found that around the park, we would have young men who were smoking things and doing different things around the park, but they would respect the inside of the park by not coming inside. And this is what the information that I had before we actually did the project was to me. They said to me, if you have members of the community, it's such a close community that people would respect security aspect of the community. But what happened at night was interesting, was because we had a gallery situation where families were invited to paint, draw, and different things. What we were having as a security breach was people stealing the artwork because they thought it was from their community and it belonged to them. And also the games, people came in and they would take the games and things like that. But for us, we kind of factored that in because we also wanted to know, that is information you want to know, is that if you're going to install games in the park, you want them to be stationary and fixed so that those things cannot be taken away from the space. So everything to us was part of our learning process. We didn't want to engineer anything. We wanted to really see how the community would work. So with security, the one thing that we did put in place was what they called community night watch. And these were just men, not any sort of, just men who just came and sat down in the space, and sort of everyone knew them, and sort of they were not questionable characters. So we very much worked with what the security within the community was, and also knew that a barrier to people's entry would be having uniformed policemen or soldiers or armies or people of authority. So we didn't want that to be a factor.
Mm-hmm. Okay. There's a new question that's just come through also from Kano State. The Maids Culture Project was held in Lagos State, and Lagos happens to be the formal capital of Nigeria, which means that there are a lot of tribes in Lagos. Did the project consider other cultures apart from the indigenous culture?
Okay, thank you for that question. Very interesting question. And in fact, the reason why we're here will answer that question. When we were trying to develop the project, we called part of our work was going out and asking different people what their public space is. When you go into the public domain, you meet everybody. You meet women, you meet children, you meet people from different religions, with different languages, and we really like to capture the diversity of labor in that sort of market on the one side, and it has things like the Afro-Brazilian returnees that came, and they sort of influenced the nature of that place. And then you have the actual Saros and all of that, and the Reunions. So things that influence the space in itself, and why we wanted to have the location in that space. It's even called the Brazilian Quarters. So we made sure that in our questions to everybody, we were taking into consideration gender, age, language, even people that were educated, even education level, and all of those kind of things, to understand how people see public space, because that was essential to the output, because we needed to make sure that we were catering to as many diverse needs as possible. So yes, to answer your question, the project did consider different cultures with different languages and different religions, because we didn't really find, so we didn't really get much from the religious centers, because I guess it couldn't really communicate what we're trying to do to them. But just to point out that the fact that we went through children was very indicative, because the children forced the parents and the aunties and the uncles and family members to come out and be in that space. And we knew that we needed the project to start from the children, which is why in my presentation, you see there's a poster that says community fun events. We learned that if you make the project sound serious, or if we came out and said we're doing a research project, we wouldn't get the community coming out. And so the children brought out the different people, the different cultures. And we went, okay, more importantly, we also went to the schools. We went to the suburbs, the government agencies that were in charge of the primary schools and the secondary schools, and told them about the project and the possibility of them informing the public schools around that area to get the children to come out and engage and play. And interestingly, obviously, the children came in their school uniform the first day. A lot of them came in their, even if it was a Saturday, a lot of them came in their school uniform. This was another thing that we learned and we observed. The next day, we had everybody wearing their normal clothes and just coming into the space. So there's so much to share about this project.
It's wonderful. I can feel just, you know, how involved it was, and then also just how much passion there is around it. It's really good to hear. I would just like to read a comment now from Dr. Nneka Onwu, who officially launched the session for us this morning. The two presentations were quite informative, and I am encouraged. At NPHCDA, we are introducing some of the innovations discussed here. What is interesting is the use of human-centered design in government, and from our orientation, we find that we may not be utilizing the PLA and HCD in our project design. I am interested in this adolescent-friendly center and how that is being sustained, which I think we have now covered. But that's really good feedback. Thank you for those case studies. I have perhaps now some slightly more general questions about the applicability of human-centered design in these kind of work. But I think it does overlap with a lot of the things you've been presenting as well. And one of the questions that comes up very frequently here is about collecting this qualitative data, whether that's through the focus groups and the social media mapping and so on that you were doing, Dr. Taiwo, or Malaika, through some of these creative explorations. How do you actually take kind of these large amounts of qualitative data and analyze them and draw meaning from them? What's the kind of processes that you might go through to do that?
Okay, so I might start here. Yeah, it was quite a large data set. As a matter of fact, we collected about 226 data sets, right? Including focus group discussions, key in-depth interviews, and a few interviews with different categories. So we had adolescents, very young adolescents, 10 to 14-year-old. We had older adolescents, 15 to 19-year-old. We had female adults, male adults, religious leaders, traditions, all category head workers and all. So it was quite a large data. It was not an easy process to analyze because we use some softwares which helped us. So we used the Atlas TI software, which helped us to be able to analyze that large data. We got a lot of experts in data analysis, in large qualitative data analysis. It took quite a while. I think the analysis and the reporting itself took close to 3-4 months. It was quite time consuming because we were also iterating. So for instance, when a level of analysis was done, we would reflect on it, try to interpret it and see what makes sense out of this data. So that was one of the reasons it took that long time. So there was a lot of back and forth with the team, the analysis team, to make sure that we got a very good report that everyone would read and appreciate. Apart from that, we also decided to conduct a validation workshop where we pulled together experts from that field, and we also put together some representative of the communities where the data had been collected. We made presentation of the data, and we asked them to reflect on it and validate whether they think this is right, this is correct, or they think we're making some claims that may not be appropriate. So practically all the data were validated and some additional inputs were added to it. And so we used all of that. So it was really a painstaking process, which took time. But at the end of the day, we were assured that the final product was going to be acceptable by everyone and was going to be useful for future references. So we didn't mind taking that process. Yeah, thank you.
Thank you. Actually, related to that, we've had a question through from Dr. Imam Wadabello, also from Kano State, asking about qualitative study design and how human-centered design differs from that, or what those differences might be between qualitative study design and human-centered design. And I'm going to open that up to the whole panel, and perhaps even one of our representatives from Scope could also be positioned to respond to that one. Who has a comment?
Hello, this is Joan Vignettes from Scope. And
welcome, Joan.
Yeah, I think, well, it depends how we understand qualitative research. For me, the first point will be we need to define very well what it means about qualitative research, about design, and it's about, because normally the idea is qualitative research, it focuses on obtaining data through a kind of an open-ended and conversational communication. And if we define it that way, we could say that they are pretty similar, but I will say that The difference is on the application, on the way in which we, in human-centered design, in the way in which the process of making sense of all the insights and data, and then also in the way in which we do all the storytelling. It's not about using this research to create a report, and it's more about using all these insights to inspire people, to provide inspiration for them to generate potential solutions. But I think it depends a lot about what we understand, and how we define both methods. But in general, I would say that both are kind of open-ended and conversational communication. And of course, human-centered design, it's using a lot of tools and methods coming from the qualitative domain, and especially from the anthropology and the ethnographic approach.
Thank you, Joanne. Absolutely. And I think there's a comment to add to that as well about kind of this design research part of that we're talking about having a specific qualitative study, that it's not just this one piece of research within the project, it's this continuous co-design and continuing to involve the participants as we go through, develop the product or the service or the intervention. And that is something that we will be exploring further in the next session on iterative development. So I would encourage anyone who's curious in this area to join us again on the 18th of February, where we will discuss that in more detail. Is there any more comment from the panelists on that?
Sorry, I got kicked out for a second.
I'm sorry we lost you, Malaika. We were just discussing the differences between qualitative study and human-centered design. But we have some more questions here to explore. There's one here. Do we still have, I think we still have our Dr. Kolo, and I think maybe Dr. Akinlade has had to drop off for network issues. But we have a question here that is about how elements of human-centered design might be integrated into government planning. Dr. Kolo, if you're still there, is that something you'd like to respond to?
Okay, thank you very much. With the elements of the human-centered design that we have learned in the course of the work that we have done, I think it can really be integrated, because we have the different stages where we co-create, designed, and then tested. And at these different phases, we found different stages of the work. And then it's the human-centered design. It's has a more human face, and is a more adaptable. And then it deals with what is the things that are on ground, the situations that you see. Because when you create, you go into the field, you design, and then you adapt your design to what you find on the field. And with that, you would see what is on ground, and then you will be able to apply it to your day-to-day work. Because in government planning, I think it's better for one to be realistic. One, because of the situation we're in right now, and because also because of the economic situation. And then a lot of things have to be adjusted. And when you see what is on ground, you know exactly what you're dealing with. And then one is able to put this into planning, and then bring out a better service delivery, and also demand declaration in the primary healthcare system. I hope that answers your question.
That's wonderful. Thank you so much. So I think we're getting towards the end of our time slot for this session now. I would invite each of our speakers share any final messages that you have, maybe a summary of what we've been discussing today in terms of what human-centered design is and how it can benefit healthcare work. Dr. Taiwo, do you have any thoughts about how you might summarize or wrap up this discussion we've had today?
Right, thank you. So we've all agreed that human-centered research puts up a human face to the design of the research, and of course, which translates into the appropriate intervention that addresses specifically the needs of the people. So for those of us in development field, it's very critical for us to take this on board, because a lot of times our assumptions may not necessarily meet the reality and the needs of the people. So it's always a good and recommended approach for to have an implementation around human-centered research, to be able to understand the situation of the people, to be able to put yourself in the shoes of the people and design an intervention that is appropriate and that is well targeted to meeting the people. I will also mention that we all know that government has the largest purse. Budgets are developed annually, and the budget are expected to be translated into development and addressing human needs from all sectors. My recommendation here to the government is stakeholders who are responsible for planning and budgeting, particularly social infrastructures, health service delivery, should first of all integrate human-centered research into their planning process. I think that this research that is well implemented will inform the strategies and the approaches of government policies and government programs. And you would see that communities will have ownership of these programs when it's actually addressing their needs, and when they see that they have been engaged in the process of identifying the problems and defining the solutions for themselves. And so we would not have abandoned projects anymore in the country. Our budgets will be well utilized, and people will benefit appropriately from the investment that everyone is making into making life better for us. Thank you very much.
Thank you, Dr. Taiwo. We also have a comment from Dr. Akinlade, who I believe is still with us, but due to network issues is unable to switch on the audio. So I'll just read this out on her behalf. I would also like to add that HCD can help us with program budgets. We will be able to review our budgets that can help us provide what is really required per community for better outcomes, as opposed to a one-size-fits-all approach. Thank you, Dr. Akinlade. Malaika, do you have some final thoughts to sum up what we've been discussing here on human-centered design and the participatory approach?
So not to repeat some of the things that have already been said. I think for me, one of the things that really helped me was that sort of like main big objective, which is like, how do we do this? And I think at the start of any sort of human-centered design project, you really need to define what that question is, that challenge is. How do we help reduce maternal mortality in so and so, or how do we? So the more specific your how do we question is, which is your big sort of challenge you're trying to solve, you can sort of use that and take it across the project at every point in time and go back to that question of how do we answer this, how do we respond to this challenge that, sorry. Can you hear me?
Yes, we can hear you.
Yes. So to try and make this quite concise, I think that for the people on this team, on this platform, whether your problem, regardless of how big or small your problem is, I think just really defining that problem as a question. How do I do this? Or how do I do that? Or how do we reduce this? Or how do we increase this? Or how do we institutionalize this? When you have that question at every point of your project, you want to sort of go back to that question and see if all the different ideas that you've developed are responding to that challenge identified as are going to be. It's got to guide you to how your this idea of iteration. Sometimes we should be aiming for small by small. So by chipping at the problem and trying, you learn, and then you chip at the problem in a more dynamic way, you learn, and then you chip at the problem in a bigger way. And slowly but surely, we will now start meeting whatever objective that we're trying to do. So that's what I will add to this conversation. Thank you.
Thank you so much. And one more comment. Thank you for sharing this as well, Dr. Onwu. Thank you. We are in the process of reviewing the PLA training document for WDC. I see that we should review our documents using the HCD. I will explore this and see how we can run with it. I'm sure the presenters will be happy to join us in this review. And wouldn't that be wonderful? Thank you so much to all of our panelists just now.